I'm June Simmons with Partners in Care Foundation, a not-for-profit in the Los Angeles area, and we are focused on new models of care that really help transform self-care and care at home and in the community. And we're putting the IT in transitions by bringing our evidence-based home medications review into the post-hospital coaching intervention where medications review is so important. This software is designed to screen so that it is selective in hitting high priorities, conditions that the prescriber is most likely to want to know about because they really impact quality of life and the condition of the patient. We think this is very important work because it captures something that's usually not visible. Hospitals and even physicians and other prescribers typically don't have an accurate database. They do not know all the medications prescribed recently, prescribed previously, over-the-counters and others that are really in the home.
Oftentimes a medication may be started and then stopped, and doctors don't know between the transitions what started, what stopped, or what a patient might be taking a duplicate of.
Almost half of frail community living have significant medications issues that need to be identified and addressed.
The HomeMeds program is important because it fills a void in the healthcare services.
Many interventions focus on healthcare professionals, but what they don't realize is that health happens at home. And so it's very important to make that bridge into the home from the healthcare systems.
We realized my mother was very confused and dizzy, and she had taken some bad falls, and we realized there was something horribly wrong. What we did was record all her medications and sent back to Partners in Care, who in turn reviewed the medications and found out that there were medications she was taking that she did not have to take anymore, and the combination of the medications were not working.
One of the things that's unique about HomeMeds is that the data collection, finding out about the medications and what's happening with the medications and the way they're taken, is that almost anybody can do it with a little bit of training. So a family member, a neighbor, a nurse, a social worker, anybody can learn how to write down the information and put it into an iPad or a computer system, and then send just the cases that have a possible problem to the pharmacist.
And then with the software, the pharmacist can utilize real-life home regimens and give practical intervention to the physician.
HomeMeds is being used in 8 states and 28 different sites, and beyond care transitions programs, we're also using it in home health. We're using it with home care agencies. We're using it with area agencies on aging, care coordination programs, and programs that are keeping people out of nursing homes. And one of the challenges is that many of these programs already have a data system, so we need to link up our HomeMeds software so that they're not using it in addition to their normal workflow. And we also want to be able to bring in the information from electronic health records and other data sources so that when they go to the home, they can spend more of their time talking to the patient about how they're taking their medications rather than writing down every medication, so that the only thing they have to write down is anything that's not already known in the system.
Our vision is to have the HomeMeds risk screening tools embedded in all the health information and telemedicine tools available when we're serving older adults living in the community. We want a true public health solution. We want it to be like fluoride. When you drop it in the water, it goes to all the teeth. And so we would like to have it readily embedded and the information flowing directly to all the prescribers to really protect people from these dangerous medications issues.